we're not here to fix people's problems. We're here to hold your hand through this journey and empower you with the knowledge that you need to take that next step and realize that's it. We're here with you. These complex chronic diseases, especially autoimmunity, they're skyrocketing, 19% annually, 80% are women. They're a top 5 issue for payers today. In 3 years, they're going to be a top 3 issue. We make money helping people stay sick. We don't actually go further upstream to understand the root cause. And the root cause is not just, I got this diagnosis, here's the protocol, here's what you're going to do. Each one of us is unique. And what we do differently in Thymus Health is that we value equally your physical, emotional, psychological, and your epigenetic data. Human connection is not going to go away, and so I don't want to lose that, but I also need to place myself in environments where I know what's going on with the change from a technology point of view, from how is healthcare changing, how is other businesses, how are they evolving? And that healthcare, going to what I'm doing now, is so behind.
Hello there and welcome to Skyman and the Bug. I'm the Bug and that is
the Skyman.
We are here to build relationships, technology, and work on the many wonders of being a business owner and a nutcase. Thank you for joining us, and we look forward to you listening to us, laughing with us, and taking the journey with us as we build businesses and relationships. And hello there, and welcome to another episode of Skyman and the Bug. My name is Roach, and of course, maybe not of course, but I am the Bug, and my cohort and co-host is
the Skyman,
Schuminsky, and we get together with dynamic people around the world to see what makes them amazing in the communication, relationship building, tech space, and then today, healthcare. And we have nothing more than a tech/health CEO who is happy to be in the Silicon Valley area, which we have friends and family and sometimes enemies in that area. So, Dr. Payal, thank you very much for being here today.
Well, thank you guys for having me.
So, Josh, you want to go and take it off and give the first question, which I normally don't do.
So, Dr. Payal, tell me a little bit about your company and what makes you tick?
Our company is Thymus Health. We are your autoimmune specialist, which means that we are the telemedicine site that can address 150 autoimmune disorders. Our studies have actually shown that we drive an 80% remission in symptoms within 3 months, improve objective laboratory markers by 20% after 6 months, and reduce the total healthcare burden costs by 80% each year.
That's tremendous.
Yes. So what makes me tick is also the same reason that we are building this company, which is that medicine is focused on decreasing symptoms, but we need to be honest. Our models are built on sick care. We make money helping people stay sick. We don't actually go further upstream to understand the root cause. And the root cause is not just, I got this diagnosis, here's the protocol, here's what you're going to do. Each one of us is unique. And what we do differently in Thymus Health is that we value equally your physical, emotional, psychological, and your epigenetic data. We're each unique and we need to be treated that way. That can happen when you drive precision in deep analytics on the data. Number 2, we recognize that as healthcare providers, we're also humans. And with an increasing rate of providers burning out and leaving clinical medicine, they're also patients. And so when you provide medical service, we have to take care of our customers, which is number 1, our patients. We're in business because we have patients and we need to value them. But our current healthcare model, it's not about driving outcomes. So I think that what ticks me off and what I'm focused in on is that the customers are 2. Number 1, they're the patients. Drive outcomes, meet them where they are, help them understand what their data means, and help them feel empowered that we can help them heal. 2 is our providers. We need to help them. feel that they love what they're doing, they feel safe in delivering the care, that they're not going to be terrible consequences if they just don't know what they don't know. And that recognize when you do those two things, you will always take care of your payers, right? Payers are the customers that we don't like to talk about, but they are the ones who are predominantly paying for the service. They're controlling, can you get this test done? Can you see the specials? Can you see the surgery? If you take care of your customers, your patients, and your providers, the natural outcomes is costs will be reduced. Patients will start shifting the direction you want. Payers and other risk-bearing entities will be happy.
So I'm going to do a follow-up, sir. Can you tell us about your mousetrap? What makes your mousetrap better than the typical healthcare application, telemedicine application?
So one, we are doing it differently. Right now in healthcare, we spend probably 80% of time trying to figure out what the diagnoses are. Right? You're coming in with lots of different symptoms from my arm hurts, I have a rash, I'm feeling really anxious. And then in seconds, the provider is trying to size up, well, what's going on here? And once you've figured out, oh, I think it's this diagnosis, then you're going to say, okay, here's the general population treatment protocol. I'm going to apply it to you. And you just keep going that way. What we do differently is that every person is unique. You cannot customize your care plans based on the diagnosis because, Nick, you may have like 5 different diagnoses and Josh has like 10 different ones. I have to prioritize which one gets the most attention. And if I focus in on your top 3 and then I kind of ignore the other 7, how is that going to work? We're one body, like it's an ecosystem.
Right.
So we're doing it differently, where we recognize that diagnoses are important, but they don't tell us the entire story. The story is driven by go upstream to understand the root causes from a scientific lens, where the data gives us an immense amount of insight, and then customize the care with a combination of both root cause, physical, emotional, psychological, and epigenetic data. When you drive that level of precision, people start responding.
So I wanted to ask a question on 2 sides, really, to what you just said, and wanted to know where the customer comes in. And I mean, as you said, the payer, or even, so is this your application or your system and your solution more focused on providing resources for the practitioner, the physician, or whoever is going to be your diagnosis, or is it more customer facing in that I'm going to use this tool to get a better understanding of what's the root cause, as opposed to just, hey, I have a headache, but I have a history of hypertension, blah, 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 something like that.
So we are, first and foremost, we're a telemedicine service.
Okay.
We're building a platform for providers that automates 90% of their data analyses. Whoa. So that helps facilitate the surfacing of the insights rapidly. Mm-hmm. We're also building a patient-facing app where the patient is receiving monthly autoimmune consults. They're getting daily insights on what does their data mean from a combination of physical, emotional, psychological, and epigenetic data, so that you can in real time, almost every week, refine their care plan. And it's gamified. So the biggest thing is, how do we start shifting their behavior? There's also a medical chat box to help answer their questions and provide them resources. The other element is that care coordination. There are often other specialists, primary care providers in the loop. Coordinate the care so that everyone knows exactly what's going on. Get that patient to who they need to go to quicker, so that if we're addressing diseases in the earlier stages, patients are going to respond better to a multifaceted care plan, and that they want everyone to kind of be on the same loop. So it's really an all-in-one service where we train our providers, so you have standardization of workflow. We provide the service to patients, but our primary customer is payers and other risk-bearing entities, such as an accountable care organization, management service organization, because we need to realize that patients ideally shouldn't be paying that much because they pay a significant amount for their premiums on health insurance. Mm-hmm. And they want to get better.
We're going through that now.
Exactly. And that cost is going to keep skyrocketing. So what we need to recognize is that payers, they don't really have any viable solutions. You know, these complex chronic diseases, especially autoimmunity, they're skyrocketing 19% annually 80% are women. They're a top 5 issue for payers today. In 3 years, they're going to be a top 3 issue. And so what you have to build is an all-in-one service where you're providing the medical management, the 24/7 clinical support, and you're coordinating the care. Because from that lens, you're able to meet those different needs. So we work really with the payers and the risk-bearing entities because we want to be a subcontractor where when we take on their top 10% most expensive autoimmune patients, so it's a very select group, and we are going to bring that cost down by $50,000 to $100,000 annually, then that's still value added from them. And so it's about, you've got to drive the outcomes efficiently. You've got to showcase that patients are on the path of chronic disease management to even disease regression.
Wow.
And so it's a different model in terms of we're not predominantly direct to consumers. We are built that we can do that, but we realize that it's very difficult to be financially viable in a D2C model. I've done that for 12 years. It grows organically, and it's still, then you're not going to really drive impact for the people who really need it.
So if I may ask, sort of an out of the, well, I won't say out of the park, but what is the craziest thing you didn't anticipate when you started building this enterprise that you're like, wow, didn't know that would happen? It was like, okay, that's way out in left field. Just kind of like an outlier that was like, whoa, that's pretty cool. Or, oh my God, that kind of sucks. What would you say is one of those?
I think the hardest thing, besides building this mammoth of a company, is we have bootstrapped everything we've done so far.
We know what that is like.
Yeah. And
so hold on, you've bootstrapped in Silicon Valley. Let me process that again. That's challenging all the way.
Yes.
We live in North Carolina, so bootstrapping is a little more cost effective. Bootstrapping in Silicon Valley is a whole new level of, oh my God.
Yes. And we proved this out. So there, you can just imagine how much time and money has already gone into where we are today. And I think that the biggest challenge I have faced is fundraising. And what I recognize is that we don't fit into that cookie cutter company that people jump to invest in, where they want you to raise a large quantity of money.
Oh, yeah.
We are not raising from that lens. We're raising $1 million pre-seed friends and family round because we recognize we have a cash flow positive business from the minute we start. And so from that lens, I didn't realize how difficult this would be, where I'm like, number one, they're like, well, why don't you raise a lot more money? And you're like, I'm going to go in more debt. I'm going to lose fundamentally control of the company, and it's going to shift in direction. Yes. And then it's like, oh, well, we can't believe what you're doing because we need to compare you to so-and-so. And we said, yes, you can compare us to the oncology care management programs, but we're not perfectly exactly like them. And so when you think about the competitive advantage, they're like, if I can't imagine it, I can't believe it. And so I realized is that through the challenges of being where we are today, I recognize this makes sense. Most people will only adapt to change when everybody else is saying, yes, I got to because everybody else is. But if you're like one of those early game changers, you're like, yeah, you know what? Let's wait until you proved everything out. And you're thinking, I did already. But they're like, no, I want to see it. I want you to already have all the customers in place. You're like, okay.
Preach.
As a tech company ourselves, it's been bootstrapped from day one. It is, just imagine the magnitude over there in your part of the world, the Bay Area, where you are, running across the Y Combinators and you're running across all the big players who are backing every new startup with, minimum 50 mil off the box. And I'm like, wow. And you're like, I just need $1 million, or I need 5 million or 2 million, just something. And they're like, oh, well, ask for more.
Yes.
And sell your soul.
Yeah, I think that was a part where what it has done, it has actually created even more certainty in what we're doing. And I think that what I've recognized is that what I really wanted, we're a social entrepreneur. Like That's what we are. We are doing this not just for ourselves. We are doing this because we know that this will drive so much impact. I've done it for more than a decade. And so from that lens, we'll make it. And so you have to get comfortable with all the naysayers. You just kind of have to like realize, yeah, it'll make you sad for a moment, but in the big scheme of things, not to get fully jaded to stop you on the trajectory of what you're doing. And I think that that's really, again, our focus is autoimmunity, because realize that that's what all the patients are experiencing.
Yeah.
Because people literally say, I don't even believe what you're experiencing. It's in your head, or it's your fault. And you hear all this stuff and you say, no, it's real. And when we ignore it, more than half will turn into cancer. Mm-hmm. Right? So when you hear a woman and she says, I have breast cancer, that's autoimmunity. Mm. Right? Or she has dementia, that's autoimmunity. So if we focus in on that tail end, and that's where all the capital goes, and we say, cancer is such a mystery, we can't figure it out. We've spent trillions of dollars, and you have to wonder, are you sure? But it's all about like selling something to say, oh, disease is happening to you and we're going to fix it. And then people are like, I didn't have that experience.
How are you having trouble raising fundraising? Because your personality is outstanding, and you've made my day with your optimism and stuff like that. I can't believe anyone you meet wouldn't want to contribute to your cause.
Well, thank you. I will say that we have, at the same time, we've had such an amazing response. And I think what really got our attention was we were originally thinking we had to do a D2C model to prove it out. But I've done that for more than a decade. And one VC was like, wait a minute, like, yes, we have a cookie cutter way and we want to have a large percentage of equity. But I think what shifted was we're getting approached by payers and ACOs where they're like, yeah, we want to do a trial with you guys, like doing a tiny pilot and you drive outcomes, we're game on. And so for us, that's when the light bulb went off, where we're like, wait a minute, we don't need to do this linear approach. We can do this. And when we have an actual demo and the product is out in January, like things will line up. But again, it's exactly what you're saying, Josh, which is, yes, they may have trust in me and my team. But again, it's just like that. There's a formula that they're following. And so I think that my conviction is that, yes, this is hard, but it's okay. This maybe is like part of the journey in the first year. And then it's going to take a lift. And so this is part of getting prepared.
So you said your demo is going to be ready by January?
Yes.
So most viable product?
So have you like started? You have a test group or something like that? Because I mean,
we have a growing wait list.
Okay, good. Because I'm like, we're not in that wheelhouse, but it's like, ooh, that looks okay.
Yes, we do have a growing wait list, and so so we'll have the provider platform and the patient app, the first version, out by like early January. And so I think that makes it much more real. And so I think from that lens, in some ways, there's a simplification that's happening through this journey, as difficult as it is. I have to accept that. And I just have to realize that there's a silver lining, and I can choose to be like, man, this sucks. Or be like, this is what it is.
It is.
And I've been through a lot harder things. And so this is, like you got to focus in on your attitude and just be relentless.
So you have our platform here and our audience. What is your ask of the audience? How could they help you? And what do you need? What do you need?
Other than money, but also money.
Well, we're in a friends and family round. So it's really about people who learn about us. Go to thymoshealth.com. You can message me directly. It's payal@thymoshealth.com. If you're really interested and want to know more, and you think that investing in what we're doing is a worthwhile cause, then every person matters in this journey, right? This company is built on thousands of people that have come together to make this happen. This is not a great idea, let's do it. This is thousands of lives that have helped us understand how to do this. And it is still going to take a community to help us get out there and help millions of lives. So our ask is learn about us, spread the word, because each person is the change maker. It may be from saying, yes, I want to contribute to your fundraising campaign, because those are the people who actually make the most difference. I think a lot of what we hear in advertising is like with the VCs or other investors, if you really look at their payouts, there's only a few unicorns, right? So many companies who get tons of money. Are they really around 5 years later? And are they getting to the customers in a way that is game changing? And so I think the ask is that listen to your podcast, dig deeper, and help us help you be successful in the cause that we're mutually working towards.
So I want to back that train up just a little bit further, way back there, like way, way, way back. So before you were in healthcare and now a tech/health CEO, how'd you get into this? I mean, I understand you have a vested interest from a familiar standpoint, because I looked at your bio on your page. But how did you get into where you are now? Was it like, I just fell out my mother and my father was dead, and I'm just going to jump into medicine and tech? I'm trying to figure out what was the nexus that said, I'm going into this. Okay, don't go weird, Josh. Don't go weird, because I know that's where you go.
Well, what's your why?
Well, that too, but more way back before you got a why, like when you were.
Why did I choose to go into medicine?
Yeah. Before you were like this great, physician and champion and passionate about both the cross section of tech. Where did you get into this? Because there has to be it wasn't like I'm going into healthcare because whatever.
So you're talking about before age 14.
Go for it.
Before age 14.
A few years ago.
Yeah. A few years ago, the light bulb went out for me where I realized a few things. I'm a first generation Indian, South Asian descent. And I realized that number one, as a woman, the odds are against me. The culture is still that women are supportive in relationships. And I recognize, what could I do that I can be independent, I can earn my keep, I can make a difference, and I can continuously be curious. And back then, I grew up in a small town in southern West Virginia. There wasn't a lot of options. So all you heard was, you can be a nurse, you can be a pharmacist, you could maybe be a doctor, but my mom was not into that. And then you hear a lot about you can be into engineering. And business, you were like, well, that makes complete logical sense. So I looked at the practical aspects of like, based on the options that I'm aware of with everyone that I'm engaging with, what do I want to do? And I recognize that I grew up in one of the poorest states in this country. And I didn't get that.
Other than West Virginia, I think Mississippi might be in par with it, something like that. Yeah.
So it was a very practical decision around, I got to get the heck out of this situation. So I need to be able to make money, be in a career where I can constantly change it, because my spirit is entrepreneurial at my core. I can be a woman and be a human being. So people aren't going to say, oh, you're just a woman. They're like, you're a human. So you gain respect right away. And I can still be multifaceted. So I realized that if I chose family medicine, it checked off all those boxes for me. So it's a very practical decision that worked for my head, my heart, my soul, and it opened up doors. And what you realize is that, yes, it is one of the lowest paying medical professions.
Oh, we live in a medical school community here in Wake Forest University. And when you look at the hierarchy of pay, and I used to work I worked in family medicine once upon a time when I was working for the hospital. But you're right. It's kind of, you have to love it. You just have to love it.
Yeah. But you got to love the business side. And I recognize that as hard as this is, I can reinvent myself every so many years because I'm at the beginning of the gateway. I'm not at the end. I can be very autonomous in how I want to practice, but I need to be real about the hurdles that are there, and they're not going to go away. They've actually gotten much harder. But from my lens, I've stayed true to like, I do this because it's got to work for me. It's got to work for my family. And it's got to help me to feel alive.
I think that is so critical because as a founder, and you wear lots of hats, I mean, founder, woman, money hunter, if you will, it can be challenging when you get boxed into certain areas. And being in business, it does, and healthcare in some respect, give you the ability to move in different circles. And I find that in the business community and even solving problems that you have advantages that others may not have in West Virginia, just kind of bringing it out.
It's all about the lens that you see opportunity, right? So if you see challenges, you've got to kind of step away and imagine the lens from others and kind of be like, this isn't the way it was, but it is at this moment. And what I saw is that when you have such poverty, there's so many things you don't even think about because it's not even imaginable. And people at their core are kind and they want to connect. And what I recognize is that, okay, I can do that. Like human connection is not going to go away. Mm-hmm. And so I don't want to lose that. But I also need to place myself in environments where I know what's going on with the change from a technology point of view, from how is healthcare changing? How is other businesses, how are they evolving? And that healthcare, going to what I'm doing now, is so behind. Right? Yeah. It's kind of like these like walls, and then you're not really allowed to change them. And when I was in residency, I was like, wow, this is bureaucracy, like at the highest level. And I'm like, this isn't going to work because everybody's burning out back then. And I got really sick, at the end of my residency. And I was like, they're like, yeah, okay, get back to work. And I was like, I don't know about this attitude. And I recognized, okay, being in San Francisco, you're in this technology hub. Mm-hmm. And so you do get exposed to so much different innovation, but you also start to get jaded through that. And I had to keep remembering this is not the way it is everywhere else. So stay true to who I am. Human connection really matters. Technology is a helping hand. Business is a helping hand of our precision and how do we want to spend our time, our resources, but stay true to your roots. And so I still stay in that same line that I started when I was 5 years old and 10 years old, where I was like, dude, I better take control of my life because I don't have any choice. And I think that's the same true for like, we're not here to fix people's problems. We're here to hold your hand through this journey and empower you with the knowledge that you need to like take that next step and realize that's it. We're here with you. And I think I stayed true to this. And I think that medicine has really allowed me those opportunities. I think that I would have probably loved in a prior life to do a lot of other things, but it's not like there's some magic, like, oh, it's going to be like the easiest path. I think that the entrepreneurs that have really made it, they felt like they were pioneers and they felt like there were so many hurdles that they kept dealing with. And
it keeps them up, and it's perfect in line with what we do here. And why the purpose of this podcast was launched was really to show the connectivity, the relationship building, and a cross section between human innovation, but also human interactions. And how do we thrive in this large pool of technology, forgetting about that we are, at the core of us, people and beings that want to be next to each other. So I appreciate you being here. We're human. We're human. So thank you very much for being here on our podcast, for being in our circle, for being a passionate, compassionate physician, tech CEO, and driven woman. Okay, I was not going there, but okay. But
I did.
But being able to create a system that is going to help us and providers to do a better job, so that at the core that we still stay connected and we can work through some of those autoimmune conditions to have better outcomes and predictive outcomes based on what's presenting to the physician, the patient, and everybody who's involved. So thank you for being here on Skyman and the Bug. So we'll see you next time on another episode.
Okay, thank you.
You've been listening to
The Skyman
and bug. We appreciate you being here. Join us again for another episode of Skyman and a Bug. And if you have any questions, reach out to us either on LinkedIn, Facebook, and other places that you just try to find us.
Take care.
Bye.